Hi there, I'm here to talk to you about Safe Supply, what it is, why it was created, what the strategy looks like, tips for safer drug use, eligibility for Safe Supply, and how it might be different than other strategies or treatments that you've used in the past. What is Safe Supply and why was it created? Many countries are facing the public health emergency of opioid-related overdose deaths. Overdoses are one of the leading causes of accidental deaths and are often a result of altered or cut fentanyl in illegal and non-medical opioids. Safe Supply was created to provide consistent, low-barrier access to pharmaceutical-grade, unaltered, uncut, and uncontaminated drugs to reduce the risk of overdose, as well as the harmful side effects of cut fentanyl-related products. Safe Supply is not a substitute for treatment. It is not considered to be the first choice of therapy for opioid use disorder. Rather, it is often used as a stepping stone for people who use drugs to other methods such as methadone, Suboxone, or slow-release morphine, also known as opioid agonist therapies or OATs. Safe Supply is a new strategy, and its effectiveness compared to methadone or Suboxone types of treatments is still unknown. If you discuss this intervention or strategy with your healthcare provider, they will likely prescribe to you hydromorphone tablets. You cannot be prescribed any other drug, for example, Oxycontins, and these can be picked up at current safe injection sites or at participating pharmacies. You may be wondering what Safe Supply would look like for you. It is important to know that doses are individual and titration-based, meaning that you start at a lower dose and build up to the dose that best suits your need and tolerance level. Using Safe Supply should provide both a space to use drugs, should you need it, as well as pharmaceutical-grade, uncut drugs. Participants should expect non-judgmental staff, a clean, safe environment, and not be criminalized or stigmatized for using drugs. Safe Supply sites may ask you to come at different times in order to gain access to Safe Supply, such as once a week or 3 times a day. The dose is 8 milligram hydromorphone tablets, typically 2 at a time. The safest way is to take tablets by mouth, but they can also be taken up the nose or via injection, and it is always best to use under the supervision of staff. After missing 2 or more days of missed doses, you may need to restart the program. However, you will never be penalized for missing your appointments. The following are fundamental tips for safer drug use. Try to not use alone or with someone who has a naloxone or Narcan kit. Do not share medications, prescriptions, or other drugs with anyone else. Do not mix non-prescribed drugs like benzodiazepines with Safe Supply drugs, as it can increase your risk of overdose. Now let's take a look at the criteria you need to meet in order to be eligible for Safe Supply. First of all, you need to be assessed to be at high risk for overdose deaths, such as previous overdoses that required naloxone, by your healthcare team. You need to have previously documented attempts, setbacks, and complication with OAT therapies that resulted in discontinuing the treatment because you were unable to reach a therapeutic dose or cravings persist despite treatment. You need to be 18 years or older and able to provide consent. You need to have no co-prescribed use of benzodiazepines, sedatives, or moderate to severe alcohol use. You need to be able and willing to attend a clinic, supervised injection site, or pharmacy as needed to receive the drugs, and you need to be able to self-administer the drugs. If this strategy doesn't work for you, that's okay. You can choose to opt out of Safe Supply or switch to another treatment method at any other time. How is this strategy any different from the other therapies or treatments that you've done in the past? Well, the average length of Safe Supply treatment is 3 years, while OAT therapies have been less than 1 year of maintaining treatment. Safe Supply has the underlying principle that people who use drugs are knowledgeable about the culture of their own drug use and their own goals and needs. This means that Safe Supply sites and staff should recognize that some individuals will have higher tolerance rate than others, and that you have your own voice too. Stay healthy and stay safe. Safe Supply. Think about it. This video was made in collaboration with the Somerset West Community Centre. Please see the resources below if you're looking for more information.